These are not the best photographs of our two nurses. I'm sorry about that. This is Marilyn Turner and Ann Doyle, and they lead our nursing team at the Urology Center and have been responsible for training those 15 nurses as well. And their role is really just to get back to basics, look at what sort of garments you're wearing, shields, pads. Women often gravitate to sanitary pads when they first leak because those are the pads they know, but those pads are not ideal for urine leakage. And that's often the first thing we would do. Just getting the right sort of pad advice makes all the difference. And we know this one because you see them in the ads. They're running around on the beach when they get the right pad because happy wife needs happy life. Never quite understood that one. I don't know why they have to run on the beach after they find the right pad, but that's what they do. And we have behavioral modification. This is just basically educating on all the little things that we can try and work out, because sometimes it's dietary issues that might be setting it off, or just exercises that you could be doing. Then we look at the things that are setting it off, and there could be medications, there could be the coffee, tea, alcohol issue, and then we progress down a list of treatment arms that we could offer, but most of the options, most people get better with some of the conservative treatment and medicines. The medicines are fairly good, but they do have problems, so we can sometimes gravitate towards using medicines that just reduce the bladder's twitchiness, that desire that you get of frequency and urgency. But they do have side effects, and some of these medicines are not on the PBS, which means that they are a little bit more expensive because they're not on the cheaper list. In older people, they do affect memory, and sometimes we're a bit cautious. If someone is, say, in their late 70s, we don't like using these medicines. Some of those other side effects are not as big of an issue. But I think we do have a problem with these medicines because it is known that up to half of the people that get put on them will stop them, and that's probably because of side effects, and sometimes in this country because of cost. I put this up to remind me that for many years now we've been using in the cosmetic industry Botox, which is used to get all those crease lines out, and it used to be just the movie stars, but everyone's using it these days. And it's very safe, but what it does is, the reason why it works in cosmetic medicine is it stops us sort of frowning and getting those wrinkles, and therefore helps us stop aging at some level. But we can also put into the bladder, because what we're doing there is placing it into parts of the bladder where we can stop the bladder twitching. So we put a little telescope in the bladder while you're asleep, and using the natural water pipe that's there, and we can put a tiny little needle and have multiple areas of the bladder where we inject into the muscle of the bladder, and we can stop those little parts of the bladder twitching, and therefore by that just relaxing your bladder a little bit and taking that urge out. Other fancy things we can do, we can put little electrodes into your back attached to like little pacemakers that can actually stop the nerves that are driving your bladder crazy and just slow things down a little bit. And through the quirk of how we're put together, by putting little electrodes into your legs, sometimes we can retrain your bladder as well. This is all coming to us in the near future. The other one is urinary incontinence. So it does come into it a little bit, because when you get an urge and a leak, well, you leak, and that's urinary incontinence, where basically the simplest definition is that you leak urine when you don't want to, when it's not appropriate. Again, similar sort of things come up, because if there's an involuntary loss of urine, it develops into a social and hygiene issue for yourself. If you start using pads, you may be using the wrong pads. There may be a cost involved in that. But I guess these are things we don't talk about, in that if you have urine leakage, it is possible that you may have fecal incontinence as well, and that's something that people don't often volunteer. But from a quality of life perspective, you can imagine how devastating that would be. And of course, we don't talk about this either, in that if a woman thinks she has an odor, or if she thinks she's leaking inappropriately, and sometimes she doesn't know how much she might be leaking at what time, she might start avoiding sexual contact because of that reason as well. And sometimes you have to ask about that, even though it can be a little bit embarrassing, but the number of times you ask and people say, yes, that's why I'm avoiding it, can be very sad if that's what's happening. And women do have what's called prolapse disease, where the vagina can just have weaknesses from childbirth usually, and some of the organs that the vagina supports start to drop, like the bladder. In terms of incontinence, we define it in a few ways. It's getting a bit technical, but overflow incontinence is where your bladder gets so full that you don't feel it anymore. Sometimes if you've had a stroke or a spinal injury, your bladder gets so full you just leak urine because it's just literally got 2 liters in it, and you haven't emptied it all. Stress incontinence is where I cough or sneeze and I leak because my sphincter muscles down below can't control the pressure. And urge incontinence is what I've been referring to, that sort of oversensitivity where the bladder just wants to keep tickling along. This is prolapse, where the bladder, here's the water pipe downhill, and basically the bladder drops. See that little V-shaped defect, and the bladder drops and leaks urine, and that's an example of a prolapse.